Welcome to the Reprofiles, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Reprofiles.
Infertility, injustice, and all things nobody warned you about. Hello, and welcome back to the Repro Files. We had a week off, and now we're back.
And
I'm
now
Anne Marie.
we're back.
Yeah, and I'm Anne Marie.
And I'm Elizabeth, and this week we are talking about the ongoing ground zero that is the abortion pill in the United States of America. For those of you who do not follow this, the federal appeals court tried to basically put even more restrictions on mifepristone, the abortion pill, making folks trying to force them to pick it up in person, trying to roll back protections for telehealth, and effectively would have killed mail order abortion and made access pretty much impossible for rural patients because, as we've talked about before with the big beautiful bill, we're seeing hospitals are closing. 3 in my district are closing, and I don't live in a rural district. So
really, 3?
That's right.
Wow.
Yeah, 3. So
that's crazy.
Mail order abortion pills matter for a lot of people, and you know, so that was a federal court appeals court decision, and the Supreme Court effectively yesterday or the day before, right, stepped in
Monday,
with a temporary pause. Yeah, yesterday. So what do you make of all of this new sort of legal chaos that's being created and spun around this issue?
Yeah, I think it's, they're kind of throwing everything that they can to try to make something stick. So, they use the circuit based out of New Orleans. There's 3 Republican judges on that, circuit judge. And, I think they were just like, hey, we're going to try whatever means we can. And I think this is just another means of doing that. So essentially saying that you can't do mail order mifepristone, and that meant for all 50 states. Now, they based it, I think, from what I had read, they based it on the fact that in Louisiana, because this circuit court was based out of New Orleans, so in the state of Louisiana, they have one of the strictest abortion bans. It is a total ban. And by allowing mail order mifepristone, they are against that goes against the state, abortion ban.
Well, and it's probably worth mentioning that Louisiana, I was once a resident of that state, and Louisiana is interesting in, I believe they're the only state in the United States that practices a different form of basic law as a state. It's based on Napoleonic law, and so IVF is practiced differently in Louisiana. A lot of women's health care is practiced differently because of super strict standards. So, it's interesting to me because what I'm seeing here is a deliberate strategy. When the people say, overwhelmingly 8 out of 10 Americans say that, women should have, access to abortion as health care between them and their doctor, period. And yet there's these certain groups of people that are looking to choke off access to care in different ways and sort of outmaneuvering people. And that's not really accidental either, because it seems like all of this confusion is putting patients kind of with big question marks and providers because they don't know what they can legally do.
Right. And because the ban in Louisiana, but there's 49 other states that this was going to be affecting. So how does that make sense? And I think that's why the Supreme Court stepped in on Monday and was like, yo, we can't be doing this. But, which to me, to be honest with you, I was actually pretty shocked that it happened that quickly too.
Well, and I think because too, like in my mind, nurses we're taught to track patterns, and so for me, like I think this is no longer just about Roe, and I think that fight effectively is kind of over in a way. I
Hmm.
mean, this is about medication access in general, about the regulatory power of the federal government, about interstate enforcement. I mean, the idea that we would have a different law in every state regarding something like abortion just creates such a confusion.
Hmm.
And then, like, control over the FDA as well,
Yeah.
because
When
mifepristone
they
has
have
been proven,
said
yeah,
safe. Yes,
yeah, safe
absolutely.
over and over again.
Yeah.
Interesting part about mifepristone is it's actually said to be safer than Tylenol and safer than
Hmm.
Viagra, because all it does is it acts like a brick wall that stands between the signal from your brain to your growing pregnancy, the signal to make progesterone to feed that growing pregnancy. And
Hmm.
mifepristone just acts as a block so that the body can't receive that signal from the brain. It is truly um, one of the safest medications that we have ever had available on the market. And because we can't seem to legally ban it outright, right? Because the American people do not want that.
Hmm.
Then now we'll just make it logistically impossible.
Right.
And I think too, remembering that, like, not only is this about medication access and those sorts of things, but it's also about IVF access.
Hmm.
Because we are going to be in the unfortunate situation where mifepristone is needed to safely save a pregnancy going wrong from killing somebody, and we
Hmm.
won't, we won't have access to it. And that was, I saw that firsthand in the summer after Roe v. Wade was overturned. A patient in Texas who had a live ectopic and could not get care until her life was in danger. So because it's
Yeah.
used in miscarriage care and it's used in IVF, I mean, it's again, we're back on the battlefield with this.
Hmm. And it's interesting that we're talking about Louisiana, and it just made me think we should bring on one of our primed cohort
Dr.
doctors.
Ulrich.
Yeah, Dr.
Yes,
Ulrich
we should.
is
We absolutely
based out
should.
of New Orleans, and talk to her about
Yep.
what it's like now doing IVF in the state of Louisiana. And I remember one of the things that she told us long time ago, like maybe a year or so ago, was that there was like 11 or 10 practicing reproductive endocrinologists in the
Hmm.
entire state, and two of them are about to retire. So like what, I wonder what we'll have to have her on, and probe her a little bit more on the state and how things are going there.
Yeah. No, absolutely. Because she has definitely shed some light on some of the oddities of the way that the state policy affects
Hmm.
how they actually can practice medicine. And it is interesting that a federal court decision in Louisiana could just so seemingly so quickly impact all of the other states.
Hmm.
It's just this weird holding pattern that, everybody's going, what do we do? And that's the whole point. That's the entire point,
Right.
because even in states
That
where
is.
abortion is legal, um, providers are taking a step back. They're pausing. They're saying, "Ugh, is this going to be safe to do?" Because if you know what can technically be considered legal today could be illegal tomorrow.
Right. And
That's
this
pretty
was for mail order,
right.
only. Like they were saying, the ruling was that you had to be in person. But
Hmm.
and we talked about this at the top of the, 8 minutes ago, that we just said, getting people from the rural areas to be able to go into a clinic, and not only that, but all these, states that have these bans, they can't go to like 100 miles away. Sometimes they have to go states and states away just to
Hmm.
get access to care. And so they rely on telehealth and these mail order, to do that. And not everybody has the time or money. We've said this many times before, the time or money to be able to get to those states that do allow it.
Well, and it's again, it's sort of that, like, if you really want to understand how devastating something like this is, you do have to go look and see who gets hit first.
Hmm.
Because it really is. It's these patients that telehealth was their only lifeline to healthcare, and not even just abortion care, but care in general.
Mhm.
And patients, a lot of these rural patients are already used to having to drive hours to see a provider, take time off work, find childcare, transportation, all of those sorts of things. But now it's, you may have to show up in person, maybe more than once. And then again, that the rules
Mhm.
could change while you're in the middle of doing that. And that's like,
Mhm.
that's a huge wall
Yeah.
because I think, again, in rural healthcare settings, we already have fewer providers, less facilities, hospitals closing. And this was all already this time last year, prior to the passage of the Big Beautiful Bill. These things were all big problems. We
Mhm.
had rural healthcare access issues. And sadly, rather than with the ability to make a choice that could have improved the healthcare of Americans, instead, we chose to pass a law that directly consequenced anyone in this country who needs health care and who is not independently wealthy. And so, in my mind, when you block something like mifepristone, which has been again proven to be safe to be prescribed via telehealth over and over and over again, you are just removing one of the only viable pathways to healthcare that that particular patient had. And again, we've seen this play out, right? We care so very much about that embryo and that developing fetus. And we care so much about what happens to it until the very moment in time in which it's born. And then we will take away its parents' SNAP benefits and we will make it impossible to have a place to live. It's insane to me that we place these barriers there
Mhm.
and still somehow manage to blame you for getting pregnant. Like
Mhm.
it's
Well,
scary.
the messages are coming across that you need to have children when you're young and when you can afford them, right? Wasn't that a quote that came out of one of these talks? I'm not sure which
Yeah.
one, but have children when you're young, and even if you can't afford them, have as many as you can. Okay, how is that helping anybody? How does that help the person, the family, the country? How does that all help?
Yeah, I mean, here it's people are not opting out of having kids. They're not. They're
Mm-hmm.
they're being priced out of it. The average first-time home buyer in 2026 is 40 years old. 40, 40.
Mm-hmm. Mm-hmm.
In the 80s and 90s, the average first-time home buyer was in their late 20s, I think 27 or 28. So you are a young couple. You have found out that that college degree that supposedly promised you this amazing salary pays a salary that doesn't afford you to buy a house. You have no clue how you would afford childcare. People are priced out of it. Like even
Mm-hmm.
think about I think we've talked about this ad nauseum, but think even about the cost of being pregnant
Mm-hmm.
from the right nutrition and good prenatal vitamins and good prenatal care. I mean, you're talking thousands of dollars. And that's if you do have insurance.
Right.
Fertility treatment, as we've said, is out of reach for many families, especially now, and the price of gas is $5 a gallon. No, that amount of money that that couple had saved up, maybe for an IVF cycle, they're now
Mm-hmm.
tapping into that savings account to pay for their everyday living expenditures. Arizona actually was ranked, I think, 47th or 48th least affordable state in the country to live in, which is interesting because when I relocated my family here in 2011, it was one of the most affordable places to go. And so in just 15 or so years here, it has become so unaffordable. Arizonans spend $5,000 more per year on average than the average American for basic necessities like food, rent, utilities, things like that. So, and then childcare can cost more than a mortgage.
Mm-hmm.
If you have
Mm-hmm.
three children, all in some type of paid childcare situation, you're looking at about a $40,000 a year spend just
Mhm.
on childcare. And then wages somehow aren't keeping up. So
Mm-mm.
the math does not work. And we
The
talked about
math
this on
isn't
that one
mathin'.
the math is not mathing. And we talked about President I guess it was Emmanuel Macron was lecturing his citizenry about how they need to have babies, and
Mhm.
it's like this thing is like, wake up, man. Like, layer in things like student debt and job
Mhm.
instability and AI, and we have no guaranteed paid leave. We don't have
Mhm.
great access to mental health care. I mean, what could be the reason in this
I don't
situation
know.
in which you have absolutely no stability whatsoever? What could
No.
possibly be the reason that they're not having babies, Anne Marie?
I don't know. There's this thing. It's the A word. It's affordability, right?
Well, it
Like
is too, because it's
it's affordability, and I know there are certain people that just are like, we that's not a consequence. It is. People defer having one child, or they may defer having multiple children. Maybe they want to have larger families, but they just are looking at the numbers, and it doesn't make sense at all. And then, the young people going out there today, like you said, with the housing, and what is motivating them to be able to have children. It's not that they may don't there are many people that do not want to have children, absolutely fine, but there are some that do, and they just are looking at it like, how are we going to do this? There's no way that it can happen.
yeah. Yeah, I mean, I think
So,
it's really it's a sad state of affairs, because
mhm.
we could these are problems that we could fix. These are
Mhm.
problems that we have the tools, the money, the talent, the infrastructure to fix, but we have a lack of political will to do so.
Mhm.
People are more interested in wearing $5 million outfits to, galas, than they are about watching families skip taking their kids to the doctor because they can't afford the bill. Or I overheard a young mom talking about she can't afford to take her kids to the dentist. Now she feels really guilty about that because,
Mhm.
they should be able to go to the dentist. And hell yeah, they should be able
Mhm.
to go to the dentist. I mean, the fact that we don't have um, these, preventive healthcare and things that we know are pivotal to long term health.
Mhm.
And again, we just kind of keep going like, what could be the problem? While the billionaires laugh all the way to the bank,
Mhm.
and meanwhile, we're like, it still doesn't trickle down. Where, when, where, when? Where's the
So it's
trickle?
it's
It doesn't.
it's
It doesn't.
it's interesting talking about, healthcare in the nation. I just recently, yesterday, got a book. I had pre-ordered it. It's called We the Patients. It's by Matthew Zachary. He is a cancer patient advocate. And it's really, I'm only like not even halfway through it yet because I just got it yesterday. So I'm not that fast of a reader. But it's just very interesting because the first part of the book talks about the history in the US of healthcare. Like, they've tried numerous times to do universal healthcare, like multiple times, and it's always been pushed out, and it's always with this big, like, that's socialism, that's communism. uh you know, the European nations, when they decided to do this universal healthcare, and it wasn't called that back then, but in the late 1800s, early 1900s, they started doing that, and now they have, yes, we call it socialized medicine now, but they don't have people going into medical debt. They don't have people mortgaging their houses. They don't have people, majority of their, I think, if I remember correctly, now correct me, Elizabeth, if I read this wrong, but if I remember correctly, a majority of the debt these days, it's medical debt, is what people have. That's why
I,
they're going into bankruptcy.
yeah, and I mean, come on, that is well, and then too, just don't believe me. Go look it up. Go see what
Mm-hmm.
in $100 of healthcare dollars spent. Where do those $100 go? Um, Far more of that money goes to insurance companies and these vertically integrated places that are making millions and millions of dollars. These companies that have got every single channel, built in so that patients, they sell it like, oh, it's so great, you'll have everything you need. But it's sort of trapping people
Yeah.
um, into spending all their money, on in that, in the interest of that business. And
But it also feels like they're double dipping, right?
Mhm.
Because if the new drug comes out, this specific pharmacy or pharmacy benefits manager is like, oh, we're going to use yours, but you need to pay us money and we will
Mhm.
only offer your drug. And
Yeah.
then we're going to charge the patients an X amount, right? So I feel like that's a little double dip in there.
It totally is. And we've seen this happen in the fertility field over the last
Hmm.
10 years. We have seen a lot of mergers and acquisitions where a few clinics gets bought up and by a network, and then
Hmm.
before you know it, that network is like, well, we have a lot of patients that are using third party that, we should have our own egg and sperm bank. And,
Hmm.
then what next thing you know, it's like there's just these big sort of conglomerates. Again, I mean, I'm not saying that that's a horrible thing, but I think when you trap patients into those sort of circular buffets of sorts where you're kind of
Hmm.
just stuck, I feel like that's what we're seeing so much with um, the pharmacy benefit managers and the prior authorization, you know, circus. That is, a doctor says you need this medication, and now
Hmm.
your insurance company is going to call your doctor and ask them if they need the medication that you just told them that you needed.
Because the doctor
Um,
ordered it.
because the doctor ordered it.
And
Yeah, yeah,
yeah,
yeah. It
right.
always blew my mind, like when I first experienced that, and or when I first heard the term a pre-existing condition.
Oh,
I
yeah.
was
Yeah.
like, what kind of
Hmm.
sorcery is that? Like because it's something that happened before, now it doesn't like
Hmm.
it doesn't count. And again, look where the money's going. These insurance companies, their C-suites are making, they're having lavish lives while they're telling people no. Like they're
Yeah.
denying their care and profiting off of it. And it's gross, and it is um it's kind of like we keep talking about affordability,
Hmm.
like it's an economic issue, and it is an economic issue, but it's not only an economic issue because it is a health issue. It's a mental health issue. It's in many cases becoming somewhat of a life or death issue because,
Hmm.
again, look what families are dealing with all at once: the rent, the groceries, the healthcare, that
Hmm.
childcare is out of reach. And and then you add that to, if you're paying attention to kind of the way that democracy's on the ropes, it can be really exhausting and anxiety producing.
Hmm.
But at the end of the day, we know that if we don't demand more, we'll never get it. It's
Yeah.
it's very unfortunate, but I think history has shown over and over again that the corporations are never going to do the right thing because it's the right thing to do.
Right.
They're only ever going to do it because it's a regulation. And that's
Yeah.
why,
And
there's some folks that are so anti-regulation because they don't want anybody telling them what to do, but it's kind of like,
yeah,
no.
and going back to your comment on pre-existing conditions, uh, that was something that was huge before the ACA, right?
That's right.
What
Yep,
some people call
pre-2008, that was like a huge
Obamacare,
deal.
right?
Mhm.
Like pregnancy was a pre-existing condition.
Yes.
So if you decided to move jobs, if you were pregnant and you decided, hey, I got a better offer on this company over here, well, I want to get their health insurance. That pregnancy is a pre-existing condition.
Yep.
Guess what? You're not getting health insurance at the new company. So you're going to have to use Cobra. So, I think people forget about those things that we had before because they're like, oh, Obamacare, and that's terrible, and socialized medicine. But we think about the things that had happened back then. If you graduated high school and you didn't go to college, you were off your parents' insurance at 18. If you
Mhm.
went to college, you were off their insurance as soon as
Yep.
you graduated. Like I did my uh, wisdom teeth removal the spring break of my senior year of college because I knew I wasn't going to have insurance after that point.
Yeah.
Now it's age 26. Now you can keep it up to age 26. These are all different things that I think people are forgetting that before that date, those things actually happened.
Yeah. Yeah.
So,
And we know that preventive care is cheaper than, emergency care. It's
mhm,
preventive care is can save us millions of dollars, but I think you have to ask yourself why there are more healthcare lobbyists than there are people in Congress, because there are a lot of people that are lobbying to ensure that their massive profits remain massive.
mhm.
And
Yeah, there was
you
one
know,
thing, thinking about this horrible event with the United Healthcare, the CEO that was shot, and no way condoning of what happened, but it made them hit pause on their prior authorizations. It made them, hey, we need to stop denying everybody or using AI or computer generated denials. It actually paused that or slowed it down a little bit.
yeah.
I'm not saying that I am not condoning that at all. I think what happened, that is horrible, but at the same time I was thinking, well, maybe insurance companies will start thinking about, like, hey, we got real people, they got real problems, but it didn't, and everybody just kept on
Well,
kept
and we always talk
going.
about, like I said, we always talk about like, well, how are we going to afford something like Medicare for all? And if you shift the picture a minute, you're already paying for healthcare, but just not really in a way that makes sense, because you're paying for monthly premiums, you're paying for deductibles before coverage even kicks in. Oftentimes, you're paying for copays every time you go in. You're getting bills in the mail for things that were out of network,
Hmm.
and you're kind of like, okay, well, I was having a open heart surgery. I'm sorry that anesthesia group is out of network. I should have checked that before they put me under. I mean, it's so silly. So right now, we all pay into this system that, use it or lose it, you still pay.
Hmm.
And if you lose your job, then you're probably going to lose your insurance altogether. So, but if you had a system that was no premiums, no deductibles, no copays, like you go to the doctor, you get what you need. I mean, that's not that far out of reach when you consider that massive administrative overhead is like is taking place across hundreds of insurance companies. So all of these different, we're paying for all of those administrative, organizations, all of these call centers full of people to deny claims, billing departments in every hospitals that are having to fight for every single payment. Um, we're paying for profit margins for private insurers. We're paying for higher drug prices, because we don't know, negotiate as one big
Hmm.
system. So all of that is baked into the cost. And and again, that's a system that you pay for and may never even use.
And
When
there are
you
people who get denials. They How many people are going to appeal it? How many people, like individuals, they get a denial? How many people are going to have the the knowledge to be able to, hey, I'm going to appeal this, I'm going to
Yeah.
keep appealing it, I'm going to keep pushing and pushing and pushing, and there are many people that just don't have the capability of doing that. Now,
Yep.
some people are going to get an approval at the end of that, but many people are not, and not many people actually try, and that's
Well,
what they're
and they
banking
know
on.
they know the math.
Hmm.
They know how many will
Yeah.
try, how many they can
Hmm.
still deny again. I mean, that is all baked in.
Hmm.
So they that of course that they're the ones making hand over fist on the system. Of course, they don't want you to know, that instead of paying thousands of dollars in premiums and out of pocket costs, we could just bring the cost of the care itself down overall, because again, you cut out billions of dollars in administrative waste and billing waste and all of that garbage. And then what I think is really appealing about it as well is employers save money. Small businesses save money. It is a huge deal to offer health insurance when you're a
Hmm.
small business, because you're taking up, it's a is a heavy amount of money that is asked of the small business owner to pay towards each of their employees' health insurance costs. But again, we are paying so that executives can have massive yachts and huge offices and right, that's what we're paying for.
Met galas and things
Yeah,
of that sort.
exactly. So
Yeah.
for me, it's again, it's obvious. Like preventive care is always going to be cheaper.
Hmm.
And also our system directly discourages prevention
Hmm. Yeah.
because most people cannot if they're priced out of the preventive piece, then by definition they're only going to enter the healthcare system when they are a more expensive fix,
Hmm.
if you will. So, and at that time, it's kind of like it used to baffle my mind. I'm a migraine sufferer, and there's you can give yourself a couple of injections that they'll if you have a bad headache, you go to the hospital, they'll give you these injections, and it usually will get rid of your horrible headache. And you can actually get these medicines from your local pharmacy for like $3, but insurance will not pay for it. They'll pay the
Hmm.
$350 a vial in the hospital, but they won't pay for the $3 vial at the outpatient pharmacy. Like, it's more expensive, it's more complicated, and people
Hmm.
are sicker because of it. So yeah. And right now, we're paying more than any other country. We pay 18% of our GDP goes to healthcare, and we get so much less in return. We are by far um, missing the mark on outcomes every way you look at it. So anyway, so that's yeah, that's kind of the the healthcare slash affordability slash sort of like, well, why aren't people having kids? I don't know. Maybe because this
Uh,
is a bit of a hellscape at the moment, and people don't know how
yeah.
they're going to afford like to be alive for 2 more weeks, let alone like have kids and ride off into the sunset. What are your thoughts on? I mean, obviously, you and I both live in very interesting states as far as things like this are concerned. But
Hmm.
we'd be remiss to not mention the news that happened with the Voting Rights Act, because that, I think we talked about earlier with abortion. Like it seems like all we're trying to do is roll back rights
Hmm.
and liberties
Yeah.
and freedoms, and so, in one way, that's the rights and liberties and freedoms of bodily autonomy, and in another, it's the freedom to have your voice heard,
Hmm.
and not be gerrymandered out of a voice in Congress. And we're seeing this wild electoral hopscotch kind of going on across the country of
Hmm.
like, oh, we're going to redistrict. Oh, we're not. The funny thing was the day that the Arizona Senate president announced that he was going to call for a mid-cycle redistricting, that very morning I said to my husband, it's great. Arizona has an independent redistricting committee, so we won't be dealing with that. And it's like, oh, or we will. Um, so I am interested in sort of like, what are you hearing about the implications of um, redrawing congressional maps in the middle of a cycle, and the impact that that is going to have on your state.
Yeah, I mean, in the state of Florida, they just passed through the state Senate, House, and uh, Governor DeSantis just signed the whole redoing of everything. And essentially, it's all red, right? There's a blue dot, I think, in like Palm Beach County. There's like a blue dot in South Florida, and there's like one near Orlando. So they are already being sued. The state is already being sued. By multiple sources about how this is not right. you know, the state actually has compact districts, which means they try to keep the districts close together, close to like the metropolitan areas. And in one particular district now that's been redrawn, it starts in South Orlando and goes all the way past Lake Okeechobee. That's, I think, over 100 miles from top to bottom. Tell me how that's compact. That's my question. How does that seem right? It's not compact at all. And I think that that's one of the suits is going after that, is talking about how the state is supposed to have these compact things. Now, I know a lot of people are cheering, and I saw the Senate or the House, they were cheering and clapping and yay, yay, yay. Okay, so how does this make sense to the you know the party that is in power right now? How does that make you feel? That makes you feel yay, happy, happy, joy, joy? Because I think that there's going to a reckoning coming soon. And I think people are tired of, you know, having this happen. And I think that a lot of people who were very, one way are going to come toward the center. And that's what we need is more people being more centrist. And from what I hear from the people that I've been talking to over the past weekend, because this is very recent news, the people
Hmm.
that I've been talking with, they are up in arms about the whole thing. And it's not just it's not fair. No, it's not right. It's
Yeah.
not right. And then they're like, oh, but this state did it. Oh, California did. No, California voted on it first off, right? They had a, we didn't get to vote on redistricting. I didn't vote for that. That was just pushed through
Hmm.
by the people that we elected that I didn't elect. But anyway, but they're
Well,
saying, oh, these other states are doing it. Okay, well, does that make it right? No, it does not make it right.
I don't understand the mindset of trying to change the maps and the polling locations and ID requirements and all these things in the middle of an election
Yeah,
cycle.
it doesn't.
It's preposterous to me to think
Mm-hmm,
that that I mean we've always I mean you shouldn't do something because it's the way you've always done it, I suppose. But
mm-hmm,
we've yeah, to change the rules in the middle of the game
mm-hmm.
is very suspect. And
Very.
I think that it is becoming more and more clear that, you know, at the end of the day, like if they can get away with what they want to and stick within the rules, they will, but they also don't really like the rules are kind of there as a side, like an afterthought.
Mm-hmm,
So, um, I think that now we one of the most powerful tools of the Voting Rights Act was having more well now that we've rolled it back, now we're stuck with this sort of decentralized, very variable, sort of contested, depend on which court circuit you're
mm-hmm,
in. Like that doesn't seem to me to scream fairness and to
mm-hmm.
scream democracy. And it's like it's kind of a trend that we've been seeing over the last decade in
Mm-hmm.
our country of if yeah, if you can't fight fair, then just change the rules or just change the facts.
Mm-hmm.
Just call lie your way through it. And it's hard to watch because at the end of the day, like, yeah, it's a rollback across the board of so many things of advances we had made in medical research and you know just a million different ways that I think that we have rolled back, and it's going to take us a long time to recover.
I
And
agree. And I think that, stacking the deck your way, it may help you in
one
soon.
round,
Sure. But I think, again, I think there's a reckoning coming
yeah.
eventually. It may not happen sooner than we want it or that I want it, but I think eventually it's going to be like, whoa, that was hmm, very questionable.
Yeah.
I guess is all I can
Well,
say is questionable.
yes, and we'll see where things go. I mean, obviously, John
Mm-hmm.
Roberts got his lifelong legislative
Mm-hmm.
dream.
Yep.
Congrats, golf clap for him. He must be so proud. But meanwhile, like I don't see. I'm like looking across our government as a whole, and I really struggle to see where we are doing right by people in
Mm-hmm.
really any area. The economy's a mess, healthcare's a mess, education's getting, decimated by these voucher systems. I mean, it's just like everywhere you
Mm-hmm.
look, it's kind of like, what are you doing for the people?
Hmm.
What are you doing to improve the lives of your citizens?
Yeah.
Um, I mean, the only thing I ever hear is, well, my stocks look good. Well, tell that to somebody living under a bridge.
Yeah.
I'm so glad that your stocks look good.
Hmm.
Um, but until when people ask me like, well, if you have to pick one thing, what's the single biggest issue to me? To me, it's healthcare because until you take care of people's very basic needs, um, you know, you can't really expect greatness from them,
Yeah, that's
you know.
Maslow's hierarchy of needs, right? I mean,
Yep. Yep.
day one of
Yep.
nursing school. That's
Yep.
what we learned.
Exactly. We appreciate the way that we can kind of bring whatever is at top of mind, we can bring to you, and you always are here for it. So until next week, I am Elizabeth. This is Anne Marie, and this
Yes.
is the Reprofiles.